The table that I've put together here demonstrates that not only is lifestyle medicine not inferior to many of the other treatments that we consider good practice, such as prescribing drugs, for example, but actually it's often superior. Take, for example, people who are at low risk of having heart disease or a stroke. Being given a statin every day, a cholesterol-lowering drug, every day for 5 years. 217 people like that need to take that statin for one of them not to have a heart attack. For the other 216, doesn't make any difference. 333 need to take it to prevent a stroke, and yet for every 200 people or so that do take it, one will become diabetic, and for every 20 to 50 people that take it, they might develop muscle damage as a consequence. Now, I'm not saying there is no place for these drugs. Please don't misunderstand. I'm not telling you to go home and immediately stop all the drugs that your GP or cardiologist gave you to take. But it is just worth bearing in mind that this is apparently evidence-based medicine that we as GPs are incentivized to prescribe, and yet it's not all that powerful. Let's take another example. Blood thinning or antiplatelet drugs, which you take if you've had a stroke or a heart attack. Again, considered good medical practice. I'm not telling you to stop, but it takes 77 people to take one of these drugs to prevent a further heart attack, 200 to prevent a further stroke, and 333 for one person to avoid death as a result. Blood pressure is another disappointing one too. In a day and age where we are told all the time that we must find more and more people with raised blood pressure, actually, if you've got mildly raised blood pressure, by which I mean a reading of less than 160 over 100 millimeters of mercury, no lives are saved by treating mildly raised blood pressure. And yet for every 12 people that you do treat with drugs, for example, somebody might fall over, break something, or possibly suffer a kidney injury as a result. The good news is that lifestyle medicine is more powerful. Take, for example, eating the Mediterranean diet. And we can compare this directly to people taking statins for preventing their heart attacks and strokes. For every 61 people that eat a Mediterranean diet, one person's stroke, heart attack, or death is avoided. More powerful than the drugs, and as far as I'm aware, there are no harms from eating the Mediterranean diet. Let's think about losing weight as another example. For every 7 people that lose a significant amount of weight, one person will avoid diabetes. For every 13, someone will avoid hypertension. And for every 14 people that lose a significant amount of weight, one person will avoid lifelong disability. Let's just think about that. The pain, the suffering, the medication, the time spent with medical professionals, and of course the cost to the system, all avoidable through this intervention. Looking at something like depression is another good example. In the SMILES trial, people who had moderate to severe depression under the care of mental health professionals taking medication, for every 4 people that ate a modified Mediterranean diet, one of them, a quarter, went into remission in terms of their depression. And finally, and perhaps most impressively, we could look at the low-calorie diet for people who've developed type 2 diabetes. This evidence is so impressive that there is now what's called a pathway to remission, the very low-calorie diet, which is commissioned all across the NHS. If you have long-standing type 2 diabetes, which tends to come on in middle age and often be weight-related, for every 2 people that stick to a very low-calorie diet, one person can reverse their type 2 diabetes. Even more impressively, if you are newly diagnosed within the last year, almost every single person with type 2 diabetes can reverse their condition. And that is the power of lifestyle medicine.